Good afternoon, everyone, and welcome to the Board of Pharmacy's webinar today. I'm Tom Glenski, the Chief Inspector with the Board. With me today, my guest is Kim Grinston, the Board's Executive Director. So welcome today, Kim.
Thank you.
Today, our topic is we're going to give a review of the 2015 legislative session and how any of that affected pharmacy, and then we'll give an update on some of the regulations that have changed and some of the proposed regulations that the board's working on. Before we get started, just if you haven't been on one of our webinars before, you're in listen-only mode, you've been muted. If you have any trouble getting audio over the internet, you have an option on your GoToWebinar toolbar to select the telephone, and it gives you a phone number and an access code that you can call in and listen via the phone if you're having trouble with the internet. This program has been approved for 1 hour of CE by the board. You must be officially signed up and logged on to GoToWebinar on your computer. If you're in a room listening under someone else's login, you will not be getting credit for that. At the end, there's a post survey. We'll go over the instructions more at the end, but to get CE, you must submit your survey back. And we do not report CE at this time to the CPE monitor, so we do mail out certificates, so you'll have to keep those. Handouts are posted on the board's webpage. We usually get some people asking where. If you go to the board's main homepage, where it gives you the sign-up link for the webinar, if you scroll down a few lines, you'll see a click here for wet handouts, and you can download a PDF version. We do make a recording of the webinar. We try to post it in about 14 days. It's a YouTube, will be on YouTube. All our past videos and webinars, our webinars are on the board's website. If you go to the menu under videos and webinars, you'll see a list and links to all our YouTube recordings. There is no CE for watching a recording. We will, time permitting, take questions at the end of the webinar. If you'd like to ask a question on your GoToWebinar menu, there's a place to type your questions and hit send. And you do that, we will get your question here, and we will try to answer those. So we're going to get started. Just kind of the way this webinar is set up today is Kim will discuss the 2015 legislative session, and then I will go into a review of the new and revised regulations and what the board is working on that way. And then we'll have a section of just some of the new things happening at the board, followed with the question and answers from the participants. So I'm now going to turn it over to Kim to do her legislative update.
Thanks, Tom, and good afternoon, everyone. Again, I'm Kim Grinston, Executive Director for the Board of Pharmacy, and I'm going to be talking to you today about the 2015 legislative session and some things that happened this year, some new initiatives that passed during this last year, and what we may expect in the 2016 year. Before I do that, I want to commend everyone, of course, for attending the webinar on today. I think this is one of the more important webinars that we do because it gives us a chance to let you know what's happening in the board office. I would also encourage anyone who's interested to please look on the board's website and look at our meeting schedule. The board meets several times throughout the year in Columbia, Missouri. Attending a board meeting is always an excellent way to see what it is the board is actually working on. The newsletter and the webinars just give you a snapshot of things that the board is looking at and things that may be coming up in pharmacy in the future. A lot of times I get emails and phone calls about rules or board interpretations of certain statutes. That's where they're discussed at the board meeting. So again, I would encourage everyone not only to just learn what's going on, but to come out and interact with the board during a regularly scheduled board meeting. Having said that, let's talk about the 2015 legislative session. This session is different. I think for those who attended last year, I was able to tell you or give you a very long list of things that passed that may affect the Board of Pharmacy. Or the profession of pharmacy. I'm going to start in another place this time. I'm going to tell you what didn't pass, because I think this legislative session was probably more historic because of the things that did not pass, as opposed to those that may actually have crossed the finish line. Of course, as many of you may know, there were several proposals this year to enact or establish a prescription monitoring program for the state of Missouri. For those who are not aware, the board is in support of a prescription monitoring program that would be statewide. You've heard in probably every news outlet in the country that Missouri is currently the only state without an enacted PNP. I always qualify that data because while other states have a PNP, it may not be fully active. However, Missouri's is neither existent nor active, so it puts us really as the only state in the country right now. There were 4 versions of that bill, and many of you may have seen the media releases on the PNP program that were proposed. And as you'll see at the bottom of the screen, it did not pass this year, so we do not have a PNP program that will be implemented as a result of 2015 legislation. As an FYI, some of the objections that were raised during the discussion of the bills. One objection was generally the idea of maintaining such a confidential state database. And while it was explained that those databases exist throughout the country and in other states, there were concerns raised about the confidentiality of the database and access to the database. I think that discussion was probably as big and as broad as the discussion on patient confidentiality and maintaining the integrity of the system. Whichever way it goes, the PNP program did not pass this year. Another issue was a source of funding. There were questions about how the program would be run, how it would be funded, and where that funding would come from. A lot of the additional restrictions that were proposed, I guess, for the PNP program would have increased the cost of running the program in the state of Missouri, and I think towards the end of session, they were probably at a point where the project as proposed at the time was probably not affordable. So the PNP bill was proposed. I think that we'll see that again in next year's legislation, but just as an FYI. Many of you also saw that Representative Lynn Morris, who is a pharmacist, also filed a medication synchronization bill. That bill actually made it through both houses in hearing, but did not reach a final debate. I don't know if that was because there was a concern with just the MedSync language and or the idea. I really think that there were so many other things moving this session that it just did not become the highest priority at the end of session. It wasn't an emergency issue. It wasn't an issue that really required immediate public attention. So I think that in the rush of session, it may have just gotten lost at the end of the legislative year. Medical marijuana. We saw some other very different proposals on regulating and or legalizing medical marijuana in the state of Missouri. They moved a little bit closer to passing this year than they did in previous years. As you all may know, there was a bill that regulated hemp oil for medicinal purposes that did pass. The discussion was a lot more rigorous, and I think it went further this year, again, than in previous years. I believe we'll see it again. And then MAC pricing and MAC costs. That bill also was filed at the legislature, did not make it across the finish line. I can tell you again, I think that there may have been concerns just about the language and the concept. But I think the overall problem this year was, again, the speed of session and other things that just took legislative priority. Board legislation that was proposed. And as with the previous side, we had several things that the board proposed that did not pass this year. Again, there may not have been objections to the language, but I think it just got caught up in the hustle of the legislative session. The board filed a bill that would require all pharmacists to report disciplinary actions in other states, and that would include adverse actions by Medicare, Medicaid, and other state governmental entities. It wouldn't require reporting of things that would not be final. Only final disciplinary action would need to be reported to the board. That was proposed. It was approved by the governor's office, actually moved just a little bit at the legislature, but did not cross the finish line. Non-resident renewals. The board also proposed a legislative suggestion that pharmacies, non-resident pharmacies and non-resident drug distributors had to have a current license in their home state if they were to apply for renewal. This is pretty much the standard that we enforce today, but we wanted legislative authority to enforce that. As we explained at the legislature, and I'll give a little background on the history of that bill, pharmacy is regulated nationally under a system of comity. We understand that there are other state licensing boards that are regulating the entity, so our need to go in and inspect the entity and or to monitor the daily activities of a pharmacy, let's say, would not be immediate because we trust that another state agency is regulating those things within their borders. We regulate the state of Missouri, and we would assume other states would do the same. So a pharmacy that has a license in Arkansas, in Illinois, in Kansas, Kentucky, they come to Missouri under the understanding that you have another state regulatory body monitoring what you do and with the ability to affect that license should there be an issue of noncompliance. Recently, we've had some states stop licensing certain entities who have then applied to renew their Missouri pharmacy and our drug distributor license. The board's proposal would have recognized that you need a valid license in your home state in order to renew in Missouri. The board also had a proposal for statistical reporting. As you may know, the board licenses over 35,000 licensees, and if you include the other medical boards here, including the Board of Healing Arts and the Board of Nursing, we touch and or impact a significant portion of the healthcare industry, either via the practitioner or the entity itself. We proposed legislative language that would have allowed the board to participate with third-party entities to gather statistical information about our licensees. We are often asked about access in the rural areas. We are often asked about specialty pharmacy services. We're even asked about immunization availability and or the pharmacists that are providing MTS services, and if so, what communities. Right now, the board doesn't collect that information. And for many of the entities, and this applies to a lot of our private entities and also some governmental entities, there were questions about whether they could apply for federal funding, grant funding from different agencies and entities without that statistical data. So we proposed a bill that would allow the board to collect that type of statistical data, but wouldn't allow the board to collect things that really wouldn't relate to the practice of pharmacy, such as salary information, income information, or revenue information, if you will. Again, that was another bill that really didn't have much controversy attached to it, but again, didn't cross the finish line, I think, again, because the legislative session was just so very busy and very full. But we do anticipate proposing that again. That bill was jointly sponsored by the Board of Healing Arts, the Board of Nursing, and the Dental Board. As we talk about and as we look at the federal push to recognize provider status for pharmacists, and also as we talk about extending pharmacists' clinical authority and or availability, I think some of those statistical numbers would be helpful and if not necessary to support the idea of or the concept or the argument of where pharmacists are needed and what pharmacist services are available in the state of Missouri. Next slide. So I've told you about everything that didn't pass. Let me tell you about what did pass. Honestly, not very much this year. That affects the Board of Pharmacy or the pharmacy industry. I just want to give you an update on one bill, and that would be House Bill 709. House Bill 709 had a lot of information in it that may not relate directly to the Board of Pharmacy and includes some language for the Department of Insurance and some other licensing boards. But House Bill 709 did extend prescriptive authority for APRNs, PAs, and assistant physicians to Schedule II hydrocodone products. That becomes effective August 28, 2015. So APRNs, PAs, and assistant physicians are now authorized to issue Schedule II hydrocodone products after August 28, 2015. Let me correct that. Subject to the 5-day supply limit that otherwise would apply. I think you may be seeing some guidance from BNDD in their next newsletter on this, but that is a change that pharmacy should be aware of. I want to stop for a minute and talk about PAs and assistant physicians. We've had a physician assistant classification that has been recognized in Missouri for some time now. Last year, 2014, the legislature passed a bill for assistant physicians, which are different from PAs. Assistant physicians, and I think we talked about this on last year's webinar, would be doctors who have graduated from medical school but haven't completed all of their licensing requirements. We were told that that may be because they were unable to find a residency slot or they're in accepted residency and thus have not been able to be fully licensed. The Board of Healing Arts, they are now recognized as a class and have some prescriptive authority. However, that authority does not take effect until the Board of Healing Arts promulgates rules. And as of today, the Board of Healing Arts has not done so for assistant physicians. So assistant physicians are not licensed right now. They are not authorized to prescribe in the state of Missouri. Just want to remind everyone of that. I think it may be confusing. The difference between a physician assistant and an assistant physician. I think for prescriptive purposes, you may not see much of a distinction at the pharmacy level, but please know that PAs and assistant physicians are different, and when they are fully recognized to prescribe, assistant physicians, they will be subject to pretty much the same requirements as PAs and APRNs. Next slide, please. So if I had a chance to look into my crystal ball, and I'm getting ready to turn this over to Tom on what we should anticipate seeing in 2016, I can give you a couple of guesses of what I think may hit the legislature this year. And I say this because the board's mission is to protect the public. We do legislation that would affect the practice of pharmacy, but the board by statute is not authorized to lobby for pharmacist initiatives or things that would primarily advance the practice of pharmacy. The board may take a position with permission of the governor's office, but generally the board doesn't sponsor legislation that is more pharmacy profession advancement related as opposed to regulatorily focused. So what do I think we'll see in 2016? I think we will see some proposals to expand pharmacists' authorized clinical services. The board doesn't have a proposal on that, but I do think that probably will land in this year's session. I think, again, immunization, I think we may see proposals to lower Missouri's minimum age for immunization by protocol. By a pharmacist. I think that may actually show up this year again. I can't clearly predict it, but I think we will see it. I think Medicaid expansion is going to be on the table again, and that affects pharmacy. For those who've been watching the news, that is always a difficult discussion. I think that discussion will continue. I think we will see PMP legislation again. I don't know how successful we'll be in the state of Missouri. We're hoping for the best, but I think it will be proposed. I think we may see a leaner version of previous proposals just to accommodate some of the privacy concerns and some of the access concerns that were raised during last session. But I do believe we will see another PMP bill that will hit the legislature this year. Finally, MAC pricing. Oh, someone just asked, what does PMP stand for? Good question. It's the Prescription Monitoring Program, or the Prescription Drug Monitoring Program. Those who may know it as a PDMP. It is the statewide program that would monitor drugs being prescribed and dispensed in the state of Missouri. So, yes, I do think the PMP bill will be seen on the floor or at the Capitol again this year. For those who have an interest, I would suggest that you go watch the General Assembly's website. All of this information is public. You can actually see where a bill is. Sometimes, and many of your associations are there, I can tell you that the voice of pharmacy does make a difference. Right now, we only have, I believe, 2 pharmacists, practicing pharmacists that are in the legislature. We have an MD/pharmacist who's no longer actively a pharmacist. But I say that to say the voice of pharmacy does make a difference when these proposals are at the Capitol. Finally, I do believe Representative Morris will file a MAC pricing and medication synchronization bill this year. I think with the conversation last year, during my history of legislative activity, I found that it sometimes takes several years for something to pass. Usually there's an education period, and then the next year you actually get to debate the merits, and then possibly the next year you might get it passed. Legislative changes are always kind of slow. I think last year with MAC pricing and med synchronization, the conversation was started. I think this year you will see more education, and that proposal may have some success. There may also be some PBM legislation. legislation that would look to regulate PBMs to some extent. The board is not a part of that right now, again, because of our regulatory function, but I think that's something that we may see. So that is the look at Kim's crystal ball and just a little bit of information about the 2015 legislative session. Tom.
Thanks, Kim. We're now going to switch to regulations, and I will give you an update of what's going on regulation-wise. And just so you know, for just a little basic 101 here, a statute and a law that is passed by the legislative body, regulations or rules are promulgated by the board. So they are two totally different entities. So these are board activities that I'm talking about. We did have one revised rule that took effect this year, and that has to do with drug distributor licensing requirements. And then we have three that the board has actually proposed, and they're out moving. They have not been officially filed at the Secretary of State's office, but they are out of the board's office in the process, and we'll talk in detail on all of these. So people say, we mainly have pharmacists and people related to pharmacy on our webinars, and you might be saying, well, why should I worry about that? This actually does affect pharmacy. Some of the things that changed here, it will make some of your practices easier to do. But effective May 30th of this year, it was revised. One of the things that was revised in it was a clarification on the 5% rule. The 5% rule is the rule that says if you exceed 5% of your gross sales and distribution and you're a pharmacy, you then have to get a drug distributor license in addition to your pharmacy license. Through the years, we've had pharmacies says, well, I don't sell anything. It's all my stuff is transferred in our corporate. There's no sales, and it was redefined this year that pharmacies that do not have sales, we will now look at your total drug purchases with the 5%. So for pharmacies that claim they don't sell anything, we will then say, well, it's 5% of your total purchases. Other revision to this is we have exemptions on when a drug distributor needs a license, and this there's more exemptions added this year. There's now an exemption for hospital to hospital, hospital to other healthcare entity under the common control or ownership of a hospital, drug distribution to alleviate a drug shortage. It's a specific kind of shortage that's been approved by the FDA. Strategic National Stockpile, that's what SNS stands for, or State Emergency Stockpile. If you're a facility that's your sole purpose is to be storing those drugs, you're no longer required to have a drug distributor license with us. And then I'm not going to talk any more about that because those are a specific type of entity. Out-of-state pharmacies who want to sell something to a Missouri pharmacy will no longer need a distributor license by Missouri to do that under certain conditions. We're now going to go down into more detail on this, but before I do that, I just want to caution you that these exemptions have no effect on any B&ED or DEA drug distributor licensure requirement or any kind of requirement by another state that you might be shipping into. So keep that in mind if you're doing controlled substances or you are shipping product in or out of the state. So hospitals, you will no longer need a drug distributor if you're a hospital shipping a drug to another hospital, and hospitals defined by being licensed by the Department of Health or operated by the state. And operated by the state would mean a hospital that is a Department of Mental Health hospital, or the University of Missouri, which operates their own hospital. They're still considered hospitals for this rule. So if you're a hospital that does not have, if you currently have a Class B pharmacy, you're already guaranteed the 5% there. But if you exceed the 5%, you wouldn't need to get a drug distributor license if it's going to other hospitals. Or the second part of that is other healthcare entities under common control or ownership of a hospital. And some of the examples would be if you have pharmacies off-site at maybe off-site clinics, or off-site locations who have a separate pharmacy permit with us maybe, but distributions to those would not need a drug distributor license. Off-site practitioners or off-site clinics. A lot of hospitals have clinics and practitioners offices off-site. They now fall under this. Ambulatory surgery centers would be another example of an entity that would be under common control if it was off-site of a hospital. An ambulance service, if it's owned or under the common control of a hospital, the distributions to that service wouldn't require a drug distributor license. So if you're currently a hospital with a Class B and you exceed your 5% and you're distributing to one of these, that 5% doesn't trigger you needing a drug distributor license. If you're a hospital that holds no license with the Board of Pharmacy, and there are some that do not, you do not need a drug distributor license to distribute to other hospitals or to any of these healthcare entities. Some examples of entities that are not under the common control that I can come up with would be independent and chain pharmacies in your locale, private physician practices. These would be physicians who are not affiliated with the hospital, but hey, they want the hospital pharmacy to supply drugs to their offices. Entities leasing or renting space at a hospital. We do have that scenario going on that they may be in your hospital, they may be leasing space, but they are really not under the common control and definitely not under ownership. Other hospitals, healthcare entities, you can distribute to other hospitals, but it does not say to other hospitals, healthcare entities. So if you're not all under the same umbrella, then that other hospital, their off-site clinics would not fall into where you could distribute to without a license. Public ambulance districts, there are some of those around the state that they're not affiliated with a hospital. They're run by a local agency. And local health departments would be another example of someone that's probably not under your common control who might be wanting to obtain drugs from you. If you have questions on if an entity meets the definition of common control or ownership, we would advise you to contact your legal counsel. We are not familiar with all the corporate setups out there, so you need to contact your legal counsel to get advice on if you meet that definition. The distribution from a hospital, related to hospital, it's from a hospital. So it's stuff going out of the hospital. It does not include a clinic who's buying drugs and then supplying them to the hospital. That clinic still falls under our jurisdiction needing a drug distributor license. Another example would be an ambulatory surgery center who's located off-site, who is their own entity, who has their own DEA number, and for whatever reason, if they're buying drugs and supplying the hospital pharmacy, that's going the wrong direction. And it does not include further distribution down the health system. So if you're the hospital and you're providing it to an off-site practitioner or an off-site clinic, they in turn can't start distributing it from their office thinking they are exempt from drug distributor license. This exemption only applies to the hospital. It's not entities downstream from that hospital. We'll move on to drug shortage. The revision says that now if you are obtaining a drug from a non-licensed entity, and that drug has been approved to be imported by the FDA from, given the approval for it, then that entity would not need to be licensed with us. Biotepa is the main example I can tell you. If you go to the FDA's drug shortage website, if you look this up, it will have a link to a letter that FDA issued to, I think they issued it to healthcare providers saying that they have granted this company the approval to import the drug into the United States during this time of shortage. What happened was that foreign manufacturer pretty much said, we are not licensing with every state in order to do this. And so this now, you you can't get it from a licensed entity, and prior to this rule change, you could only receive something from a licensed entity. So this is an example. I will tell you right now, I've only had hospital entities who usually this is affecting, but now the rule does say you must maintain the documentation. In this example, maintaining a copy of that letter that the FDA issued saying they granted the approval for the importation is what you would keep. Keep that, and if an inspector was in and say, why are you receiving it, you could pull it out and show them this is why you're getting it. A big change in this rule is now Missouri pharmacies may receive a drug from an out-of-state pharmacy without that out-of-state pharmacy holding a Missouri license. In the past, you could only receive drugs from people who were licensed by the board, the Missouri board. And so if a pharmacy out of state wanted to sell you something or distribute something to you, they would either had to hold a pharmacy license or a drug distributor license. This was a statute change about, I believe, 2 years ago. This is the subsequent rule change that allows it. But one of the reasons this was created was for some of these mediators who place pharmacies in touch with other pharmacies who have overstock or stuff that's going to expire in the near future, and they want to sell it, distribute it to a pharmacy who could use it. And prior to that, it required that out-of-state pharmacy to have a license with us. So now you do not need to do that, but there are a couple requirements. The Missouri pharmacy must maintain proof that that out-of-state pharmacy has a current active license in their home state. I would recommend, you can go, most states now all have online verifications on their website, so go to that home state's website and print off a copy of the verification showing that that pharmacy is current, and print a copy and keep that. And then, as with any distribution, this rule actually says you have to have a distribution record. We have that in other areas of law, but basically we're talking about an invoice, and it spells out the 3 things there that you must have on your invoice. And records requirements are 2 years, so you have to maintain that. I don't know how many pharmacies will be taking advantage of this, but you're going to have to maintain a file of, especially the first one, the proof of licensure, because that's something we do not require currently. And there is a 5% limit on how much you can buy. An out-of-state pharmacy can ship into Missouri to a specific pharmacy, and it's based on the Missouri pharmacy's annual sales. So I don't know how often that would be exceeded, but it is out there. A couple cautions here. Again, this exemption does not have any effect on BNDD and DE record requirements. Their records on controls are a little bit more detailed on what you have to have on an invoice, and it does not change any kind of licensure requirements, specifically DEA, that anyone you receive a controlled substance from must be a DEA registrant. And then a caution that the other state licensures applies to Missouri, may apply to Missouri. A lot of these companies I'm talking about allow you, a Missouri pharmacy, to offer drugs that you have in overstock to another pharmacy in another state. Please be cautious that some states, like Missouri used to be, said you could only ship into the state if you have a license. And you might say, well, I'm not in their state, I don't have to worry. Some boards in other states have fine authority and they can't hit you with a fine. So you want to be cognizant with that. If you are shipping a drug into another state, you better find out what the requirements are on licensures, because there are some that will require license from out of state. We just recently got a letter from another state of a list of pharmacies who was shipping into their state without proper licensure. I don't know what happened after that. I assume that state sent a letter to that pharmacy of some sort telling them of the requirement, and I don't know if there's any further ramifications from that state. The board, we're now going to, the board did pass an emergency rule that lowered your renewal fees last year for everybody, pharmacists, interns, and technicians. That was a one-time fee reduction. The board is working on permanent rule change to permanent lower the fees. I cannot tell you what those fees will be, but if you know, there was a substantial decrease, especially for pharmacists, on what you paid to renew your renewal last year.
If I can jump in here, Tom, the board has filed an emergency rule to decrease the pharmacy and drug distributor renewal fees. So the renewals that will be going out for pharmacies and drug distributors in just a few weeks now will have a reduced and lower fee.
Okay, the next, so besides the emergency rules which went into effect, we have a permanent fix, hopefully, for the fees in the works. We also, the board has approved a revision to the pharmacy technician licensure rule. It spells out a specific list of prohibitive acts on what a pharmacy technician cannot do. And then it now would require some kind of a formal training program. That can be an employee training program. It could be any kind. It does not spell out any type of program or any kind of certification. It will be up to the pharmacy to decide, but that'll be something new that you have to show that your technicians have some kind of training. The board has, just so you know, when the board wants to create or revise a new rule, we have to get permission from the division, the department, and the governor's office before we can officially file it at the Secretary of State for the normal process. This one is out there in the first stage of getting that governmental approval. And so I can't tell you right now when we expect this to even be proposed as a rule. An example of that is a rule in 2012. The board said we're okay with making some modifications to the MTS rule. To date, it's still stalled in the first phase of getting governmental approval through the three different agencies there I mentioned in that. I will tell you on this is the board has proposed to remove the 50-mile rule for the MTS rule. I'm not talking administration, I'm talking totally just MTS here, but that was one of the things that was included in this, and we cannot tell you when we expect this to move any further, but once we get the approval, we will be filing those two rules. Other board regulation activities, what the board's working on, we were working on a totally new rule for return for destruction that will let patients bring drugs back to the pharmacy for destruction or through a mail-back program. We have revisions to the board is working on revisions to the pharmacist in charge rule. The Class J shared rule, the board is working on revising that. The sterile compounding rule is still in process of being revised. We do, hopefully we'll have that out. We did put out the initial rough draft of that back in April. It's a very long rule and it's going to come back for even more discussion. And the board's looking at revising the pharmacist administration rule both by protocol and by prescription. When I say the board's working on it, it means that the board has asked staff to come up with what revisions need to be made, and the board is in the process of now discussing those. This is what Kim talked about. Come to a meeting and you will hear these discussions of these. If you want to know what the board's thinking or if you want to see drafts of it, if you check out the board's website, we have a link that says meetings on the menu bar, and you can download some of the documents and see some of the drafts that are out there. But input is always nice. The board, we always accept input at board meetings from the public if they want to give us some advice or comments on some of the proposed revisions that we do.
There's one other revision that I want to mention that actually took some significant time at the most recent board meeting, and that is the revision of our general pharmacy rule that discusses and references a sufficient physical exam in order for a prescription to be valid for dispensing. The board office has received just numerous calls from different individuals, entities, doctors, asking about how we accommodate legitimate prescriptions that are written pursuant to a telehealth or telemedicine type of consultation. The board has been asked to revise the rule to recognize those legitimate prescriptions that are being issued. The board has agreed to do so and is working through the process of getting language to do that. The concern there was, of course, to make sure that the language would still prohibit those internet-based questionnaires and or consultations that really don't include a valid patient-practitioner relationship. That rule in emergency form was approved by the board at this last meeting, actually on Tuesday of this week, and that rule will likely be filed shortly. So just one extra addition.
So again, we urge people to get involved. We're now going to do just a brief, what's kind of some of the new things going on with the board. First one is, Kim, you want to talk about, we have the second Joint Regulatory Patient Safety Conference coming up in August.
Sure. As you know, the board's mission is to protect the patient, or to protect the public, and that of course includes patients. Last year we joined together with some of the other medical regulatory boards to host a joint regulatory patient safety conference with the idea that patient safety is something that crosses all of the professional licensing lines and can be discussed jointly. So this year we are doing it again. We've added some other boards to the sponsorship roster, but the Missouri 2015 Patient Safety Joint Regulatory Conference will be held on Friday, August 28th, 2015, from 8:45 to 4 p.m. here in Jefferson City. It worked well hosting it in the middle of the state, sort of, this year, and so it will be in Jefferson City at Capitol Plaza Hotel. Registration is free and open to anyone. Technicians, pharmacists, there are limited slots. Since we are working with other licensing boards, we do have limited slots, but if you'd like to register, please go on the board's website. The program has been approved for 6.5 hours of CE, so if you need your CE, as we look forward to next year's renewal year, CE will be granted for the program. Some of the topics will include combating compassion fatigue to improve patient safety, and impaired patients. There will be a very good discussion on how to handle and or deal with impaired patients, whether you're a pharmacist, a nurse, a doctor, whomever it may be. Safe healthcare delivery with sign language. There are some interesting initiatives going on there that may benefit the pharmacy world, and also keeping patients safe in the telehealth world. I think this is a very big discussion right now as technology changes and so many things are now being done electronically or through new technology. So I invite everyone who's interested to please visit the board's website. Again, spaces are limited. August 28, 2015, registration is free.
And we just got a question, are technicians allowed to? Yes, this event is open to everyone. I believe there's 10 or 12 boards now involved in this, so there will be all kinds of other practitioners there. But again, due to the size of the room, it is limited on how many people can attend this. And I believe there was a good turnout last year for the first one, and it looks like we're building upon that with more boards getting involved and stuff. And we got a lot of positive feedback last year from the program.
Yeah, and I think one of the things that we hope to do with the program is to help break down some of the barriers and maybe walls in between the healthcare lines. And as we talk about the patient safety topics and patient safety initiatives, that communication, that conversation be held with all of the licensing entities there. So there will be physicians, nurses, social workers, chiropractors, and of course, pharmacists, technicians are welcome as well. I think it will be a very good and interesting discussion.
Some other news, we did have two new board members in the last year. Christina Lindsay from Kansas City and Christian Tadros from Moberly are our two newest board members. For you that know, we were short 3 board members. So now we're down to short 1 board member. So we are very happy to have them with us now on the board. We have some turnover in the board office. Actually, it's promotion. They've moved on out of our office, but just so you know, Kelly Bowers, who handled the technician desk, has now moved over to the pharmacist desk. That's Sylvia and Regina handled in the past. We have a new technician. Lori Coleman is our new technician person, and we have a new compliance coordinator, Jennifer Lubert, taking over the compliance desk in the last year. Just to talk a little bit about our compliance coordinator, over the last few years we have expanded their role. That person, Jennifer, is now doing some investigative work for us. So if you get a letter from her, or she may actually pay a visit in the future to some of the pharmacies, she's also trained as a drug distributor inspector. So we have a office person who's out now working in the field for us. And we do have a posting on our website for a new inspector position. We did get approval to hire a 9th inspector, and we do have a job posting out on our website if anyone's interested in looking at that. New website design. We have a new licensing system coming on board sometime this year, and we're rolling out a new electronic inspection program as part of that new system, which will not be until probably next springish before we have that program going. We're now going to take the questions that we got coming in. Some of these are related, it looks like, to the topics at hand, and others are not. So first one is asking about the current status of electronic prescribing of controlled substances in Missouri. Is it allowed? And the answer is, as far as we know at this time, it is not. We have not been told. We have an effective date of July 30th, 2015 is when the rules that will make that effective in Missouri become effective. That is a BNDD rule. It's, for anyone interested, it's 19 CSR 30-1.062, transmission of prescriptions. That will dictate how that will be done. So July 30th will be the date.
And we'll probably post a link to this rule on the board's website, but again, it's scheduled to become effective July 30th, 2015.
And I believe BNDD will probably be announcing that when it is. We got multiple questions on how the Drug Safety and Quality Act affects or the rule changes that I talked about on drug distributor licensing. Kim?
Yeah, as many of you may know, the feds have enacted the Drug Quality and Security Act, the DQSA, which addressed some of the compounding issues that arose after NECC. It included a subcomponent called the Drug Supply Chain Security Act, which many of you are probably familiar with by now. We have looked and done a legal review of our drug distributor licensing rules, including the new rule that was just revised. To the extent that our law may be more stringent than federal law, our law would still apply. So if you needed a drug distributor license before the DQSA was passed, you probably still need one right now. There may be some entities that we are still legally reviewing to see what their license status should be or needs to be in the state of Missouri. But right now, we don't believe the DQSA will affect the rule that we discussed during the webinar, including the drug supply chain security portion of that proposal. I need to tell you, though, that there are some exemption from licensure provisions in the DQSA. I would remind licensees, though, that Missouri law currently says that you can only receive drugs from a licensed Missouri pharmacy or drug distributor, with some exceptions that are recognized by the board. So as you deal with out-of-state entities, please verify licensure on the board's website. Even with the passing of the DQSA, that licensure requirement hasn't changed.
Okay,
I think someone's asking you to show slide 18 again on hospitals.
Slide 18 on hospitals.
We will. I believe that's the slide.
Is that slide 18?
I think that's it.
Okay. Let's see. How long do we need to keep the letter? I believe the only letter we talked about was the drug shortage, the FDA documentation, and the rule says that is you must maintain that for 2 years. Someone's asking, is the 5% of sales 5% of dollar amount or or doses. In Missouri regulation, it is dollars. But let me tell you, DEA's 5% is dosage units. So when you're talking controlled substances, you're talking two different things there. But all of ours is based on dollars. We have a thumbs up for lower fees, and I told the board this week that that's the one thing I do hear that everyone's happy about is the lower fees.
I think we answered this question. Is the patient safety conference for pharmacy technicians? Yes. There's another question that says, can we have a pharmacy technician as a board member? Again, I want to invite everyone out to the board meeting because this was quite the topic of discussion during this the board meeting this week. Should a pharmacy technician be added to the board? The board is still looking at legislative proposals on this. I can tell you that the board recognizes the value of the pharmacy technician voice. Because we deal with so many pharmacy technician issues. However, there were some questions about how that should be done and how the statutory language would read. But yes, the board is considering that. And again, would invite you to continue to look at board meeting information.
Will the board issue or publish minimum technician training guidelines? The answer is no. The rule that I talked about was very general. It did not spell it out. The board attempted to do that a few years ago, and that went nowhere. It was a legislative thing, and we couldn't get that to move anywhere where we actually spelled out what would be required in training or certification. There's another question about, is there any movement towards requiring technician certification? Is the answer to that is legislatively, and no, like I said, it was 3 years ago, I believe, that we attempted that.
And if I can add one comment, even on the rule that is currently under revision, it's been filed and we're going through the approval process. The board wanted to recognize the flexibility of pharmacists to train their technicians. So that rule does not have any mandatory training guidelines, but I think it's something that probably will be discussed by the board in the future.
We have this question is related to hard copies. Can you maintain an electronic hard copy of e-scripts instead of printing them on paper? The answer is yes, but you have to be in compliant with our electronic imaging rule, which is 2.085. So there are some requirements in order to do that. It's not required. It is not mandated that you use imaging, but it is optional out there. There are some limits of what prescriptions can be imaged and what can't.
There's a question about, is the board aware of any legislative or pharmacy organizations considering limiting the graduating pharmacy class size? I'm not aware of any legislation or any information from pharmacy organizations. I'm not aware of any. Doesn't mean that something may not be out there. In line with that, we have another question asking if the board has concerns about the increasing number of pharmacy schools in the state of Missouri. I can tell you that UMKC has experienced some growth. The board is aware of it. The Board of Pharmacy doesn't approve pharmacy schools, so we don't officially authorize the programs to operate in the state. It's not a topic of discussion for the board at this time. Someone's asked me to explain the MAC pricing legislative proposal. That would be very difficult to do in our time frame. But what I would suggest that you do, if you go to the General Assembly's website and you go to Joint Bill Tracking, there is a link, and just Google, put in the search term for MAC pricing. You will see a summary of the bill. You will also see the proposed language, and you will also see the different changes to the bill that were in the legislature this year. And if you'd like, if you email the board office, if you can't find it, I'll send you a link directly.
Someone's asking, do we have a link to the proposed rules about prohibited technicians? I don't believe that's on our website, right? It is if you dig into the minutes, board meeting minutes, but I don't believe currently there is. If you would send me an email, I can probably get you a copy of it, but I don't believe it's on our website.
And that's with the caution that rule is not final, but it will help you to the extent you'd like to know what the board is thinking about what a technician should be doing right now or should not be doing. That list may be helpful. Not final, but if you'd like, we can send you a link to that information if you'd like.
And here's another one on technician training. Once they're in, this rule's in effect, will it apply to new technicians or apply only to new technicians, or I think they're asking, do you have to train your current ones? And the answer is yes, you have to document that everyone's had training.
And the proposed rule, and again, it's still in the proposed stage, the proposed rule did not make a distinction between new hires and current technicians. Since the rule allows the pharmacy to train them in accordance with what the pharmacy deems appropriate, and that would include on-the-job training as well. The board did not make a distinction, but if that's something that you think the board should consider, I would encourage you to please look at the comment period for that rule, and we would definitely take that back to the board for review.
We're about out of time, so if you have any last questions, you need to submit them. We haven't received any for a little bit, so we may be done on questions.
We'll take just a second. Looks like there's a question coming in. Or maybe not. We can go ahead and wrap up.
So that concludes our webinar today. We try to do an annual one where to give you a update of the legislative session. I just know as a practicing pharmacist, I didn't pay a whole lot of attention to the legislative session, but ever since working for the board, yes, I do. But it's nice to get an update on that. The next Lunch with the Chief webinar is scheduled for Tuesday, October 13th at noon. Topic unknown at this time. If you want continuing education, when I say I'm closing the webinar, another little window will eventually pop up on your screen, and it says the webinar has ended, and then you click the little close link, and then a survey will pop up of 5 questions. Answer those questions and submit it. We understand that smartphones and tablets may not receive the survey. If you do not get the survey, you can send an email to compliance@pr.mo.gov, and we will email you the questions. But you have to have your submission back in within 48 hours to be considered for CE. We do mail out paper certificates. I always say 14 days, but it may be longer. You will get them. And again, we do have a recording of this will be posted on our website, usually within 2 to 3 weeks. So we're done for the day. Thank you, Kim, for speaking with us today. And I'm now going to close the webinar.
Thank you, everyone.